Dr. Ross, using the Tau double-blind clinical trial as an example, could you bring a potential candidate through the front door, through all of the reasons why they could be in the study, reasons why they may not be in the study, up to the point where they're approved and, as you call, randomized and get their first treatment in the program?
The Tau study is what is called a double-blind, placebo-controlled program. By that it means one group of patients will be getting an active drug. The chances are 2 out of 3 that a patient who is accepted into the program will get the study drug, which is aimed at stabilizing tau, I believe, from coming off of these filaments. 1/3 of patients, however, during the study process will get placebo. Double-blind means neither I nor the sponsor knows who's getting the drug to avoid any bias whatsoever. The process, and step by step, if I may, to describe what a patient and their loved one goes through is as follows. First, a visit, particularly here, for example, will take place in this very office, where I will examine the patient's cognitive status, administer a series of memory tests that takes between 45 minutes and 1 hour. We will also interview their study partner. By that it means a friend, relative that has meaningful contact with the person. It could be a spouse, it could be a child, it could be a sibling, it could be a partner, it could be someone that they see at least 8 to 10 hours a week to supply us with meaningful information to determine if the drug is not only safe, but does it show some effectiveness. After the patient is examined on their first visit and they appear to have memory loss that is suggestive of an Alzheimer type condition, there are 1 of 2 ways the patient can decide to proceed. Actually 3 ways. The first is they don't have to do anything. They can go home with a presumed diagnosis of either mild cognitive impairment of unknown cause or possible mild cognitive impairment due to Alzheimer's disease, or if the condition is more severe cognitively and functionally, I'll diagnose the patient with probably a mild or moderate dementia. If previous tests such as MRI, genetic tests, or PET scans have not been done, we offer the patient the opportunity, either in research or outside of research under their insurance, for example, to undergo a brain scan, such as an MRI of the brain, and if their insurance will cover it, a PET scan. Many patients opt to have these tests done through the research. If they decide they would like to enter research, an informed consent form, an ICF, which is approved by, as I mentioned earlier, an independent institutional review board. An IRB composes at an 8th grade level, meaning reading level, a consent form. This consent form talks about the risks of the study drug, known and theoretical, the benefits of the study drug, both known, published, and hopefully future results such as this phase 3 study may bring to bear. In addition, the number of study visits during the course of the study will be discussed. And at any time during the study, the patient can withdraw for any or no reason whatsoever. However, if a patient and their loved one, to the degree that the patient can process what the benefits, risks, and alternatives are, and their study partner or legally authorized representative signs on behalf of the patient, then the process begins. It starts first with a clear understanding of the caregiver or legally authorized representative, what it is they're signing. Again, the benefits, the risks, the alternatives. And the patient will also be asked to sign if they can, or if I adjudicate that the patient, in my opinion, understands sufficiently benefits, risks, and alternatives. Once that extremely important legal document is signed, the patient will undergo memory tests, blood tests, and if they come back acceptable, meaning nothing clinically significant, they will undergo an MRI. That's a magnetic resonant imaging scan. There are no radiation side effects. This is an imaging scan that does not use radiation to look to see, are there silent strokes? Is there pressure on the brain? Is the diagnosis, if made of Alzheimer's, correct? We often find stroke-related dementia, in addition to Alzheimer's, which would not allow a patient in the study. In addition to the MRI, a PET scan is an optional part of the study, which here at the Memory Center in Eatontown, New Jersey, we encourage patients to have it done so we can learn more about the functional ability of the brain. After those tests are done and the EKG, blood work is looked at again, if they are found to be within the acceptable range, the patient is assigned by computer to either receive one or another dose of this TauRx medication or placebo. And over the next approximately year and a half, the patient will come for visits to monitor safety with blood tests, urine tests, EKG, MRIs every 3 months, for example, with the MRIs, as well as a great deal of cognitive tests to see if the drug is helping. We monitor for side effects, and I, as the principal investigator and doctor, am available 24/7 by phone, cell phone, email, as my patients will readily attest to.